Hey guys, down here, welcome to Podiatry Practice Mastery. I'm going to go over my one-page report. This is the one for June 2025. So what this is the report that I go over, the goals that I pursued in May, and also my progress toward these and other experiences in May. So my focus in May was transitioning to my new medical record. So we decided to switch from Athena to ModMed, and we've had Athena for about 10 years. It was more for cost savings was the reason. We really did like Athena. There are a lot of things I feel they were better. There was less clicking with Athena. There was a lot more macros. But I think ModMed is superior in terms of billing. I think the billing is kind of integrated. It's harder to mess things up. There's a lot more checks and balances for the billing. It has kind of a podiatry specific portion of it, whereas the other one was kind of more generic. It's a little bit less modifiable, which is kind of a challenge. You have to learn how to use their templates. It has everything in there, but it's not as modifiable. So, for example, cortisone injections, DME, Q10s, Shockwave, Swift, all these things are in there, but you just have to use their templates. You have to figure out how to use their template. It has this method of doing like stickies where it can remember how to do things. One of the challenges I found is it remembers for me as the doctor, but not for my scribe. And it also only remembers within like the virtual exam room. Something, if you know ModMed, you know what I'm talking about. So we were 1 month into ModMed, and it's getting better. It really was, I don't know how to say it nicely, one of the worst things ever. There's only a few really, really bad things, and one is switching your medical record. And we've done this multiple times. This was a harder switch, I feel, than when we switched to Athena. Athena was a little bit easier of a switch. This one was a little bit more challenging. We did reduce our patient load during the process. I think we just maybe cut it in half or cut it by a third, which helped a little bit, but I was still getting home at 7 or 8 o'clock every night when we're kind of learning it. It was hard for my scribe as well. He was learning it. He didn't know what we were doing. We're still kind of sharing screens, so kind of teaching things. There's little nuances that we have to figure out, but it is getting better, and that's kind of where we're at right now. I think over the long haul, it's going to be a win. But one thing I realized is as I was switching to this new medical record, like everything else went down. And what I mean by that is when I was preoccupied with my medical record, I wasn't free to kind of think and treat patients comprehensively. Many times I feel like I was just trying to get in and out of the treatment room and not have to document more because it was a pain to document and I didn't know where things were. And so this was kind of a takeaway because I'm assuming my numbers are going to go down. But if in general your medical record is hard to do or things aren't set up efficiently to document, it's not like easy to do things, you're not going to want to do things. My joke is if it's hard to do Shockwave, I'm not going to want to do Shockwave if it's hard to document. If it's easy to document, you're going to want to do it more. So making things easier to do is really a good idea, and I think it's going to help me to think more outside of the box. That is going to be a benefit for me. So the other thing that was my focus was make use of my dad's new insurance and make sure everything is available and getting used to a day program. So I'm still kind of dealing with this. I don't know if you've heard. I've mentioned this before, but my dad has some dementia, is living with us now. And we switched all of his health care here to Massachusetts. And so that was a little bit of an ordeal. Got new medication on board, so he's a little calmer when he goes to a day program. He's going there 3 days a week, which is a really good break. And I want to get him, I'm trying to get him on Mass Health, which is the free care here in Massachusetts, but he has too much of an annuity coming in, so I'm trying to figure out how I can, remove that annuity or something like that. I'm still trying to figure out those things, but he's in a much better place. He's going to be going on vacation for a month, which I'm kind of excited about, and then we're going to go on a vacation as well, upcoming in July. We also got a new newsletter off to a good start. Giving more value to those that are part of the Podiatry Practice Mastery. So if you're not part of the newsletter, you can get it if you go to Podiatry Practice Mastery and just download any of my stuff. You'll be added to that newsletter. It comes out once a week. But I'm having a guy help me. His name is Al. And so I'm liking because he's writing it in my voice. and he's getting out the information that I want to get out. So we're working on that. It's kind of educational. It's kind of entertaining. I'm doing it very similar to my other practice newsletter, but he is helping me with that. And the goal then would be to help develop a mastermind for doctors. So I've had a couple people show interest. If you're interested, let me know. There's going to be, I'm going to start with a kind of a smaller one and see how it goes. And I'm also wondering, I want to try to work on different questions, because another thing that I'm working on is I'm trying to write articles for Podiatry Management. It's called it's like a new practitioner series. I think it's called the $1 Million New Practitioner, like how to get a new practitioner to the $1 million mark, which is kind of a nuance of this $1 Million Minute that I do. But I'm working on that, so I'm going to be asking some questions in that newsletter. Then, based on your responses, then that'll help me to write out this newsletter. Okay, so I would appreciate you. The next kind of one will be on like how to get a new doctor fully booked, because I think one of the challenges, there's no way to get to $1 million mark if you're not fully booked with patients, right? You need to be seeing 20 patients a day, $200 per visit, 50 weeks out of the year to get to the $1 million mark. So unless they're seeing that number, so the first question is, well, how do they get up to that number? So if you have other tips that have actually worked, I don't want to know theoretical tips. I know there's a ton of theoretical tips, but I want the things that have actually worked in your practice, because there's usually one or two things that have actually worked, whereas a lot of other things are just theory and no one can implement or execute on them. So if you have ideas either that they can be done or they can be done with someone else, or maybe that might be like online marketing, it might be hiring an assistant to set those things up. Let me know, because I one of the struggles I find is a lot of the doctors, they're good at doing it when it's set up for them, but they have a hard time actually setting up the meet and greets or the lunch and learns or going out and visiting places unless it's kind of set up what they should do. Okay. So that's something I'm working on. So the KPIs and my metrics. So for May, my billing was low. It was $62K, and it might just be me. It might be the time of the year, but usually I'm at about 80 or more. So $62K was low. My orthotics really went down from like 23 to 8, and then Shockwave went down to like 25. Swift went down to 4. Amnio was 1, and so I think all that might be a result of just being a little bit less busy, or even the medical record transition, or taking more time off for my dad. So I think it could be a combination of kind of like just life in general. We had 55 reviews and then 114 downloads, which is kind of a good thing for downloads. So those are new people on my email news list. So other updates, like I said, we're 4 weeks into our new medical record. It's quite painful for the first few weeks. I felt really incompetent, but we were happy with the go live. In general, with the person that helped us in the front office. Morali's starting to figure things out. Like I said, my dad, things are going well with him. We have a new online scheduling thing that's been working well. So within the medical record, they have something called Clara, which is kind of a combination of a couple of other techie things that we had. So we were using Swell to get online reviews for the last year, and it bumped up our reviews. And now Clara has this thing where after every patient visit, it'll ask them how did we do, and it'll send them a review request. So we're gonna kind of measure how that is working compared to Swell. It also has online booking, which we never had before. So we're kind of excited about doing that online booking thing. And there's a chat bot on there and things like that. The numbers went down during the transition, and I also, as I mentioned before, I see the importance of being fully supported to be kind of comprehensive with patients. And then I'm kind of happy I got asked to do this new practitioner article for Podiatry Management, so I'm going to kind of working on that. So what are my focuses for June 2025? Continue to improve the ModMed transition. Learn to do that new practitioner series with my podcast. I'll be basically podcasting about it, and then taking the transcript and then writing the article based on that. And then I'm going to set up my first mastermind for a podiatrist. I think this would both be fun. I think it'll help give a lot of value to other doctors. Anyway, this is my one-page report for June. Okay, guys, have a good day.